A growth of cells called colon cancer starts in the colon, a section of the large intestine. The first and longest segment of the large intestine is called the colon. The last segment of the digestive system is the large intestine. Food is broken down by the digestive system and used by the body. Colon cancer can strike anyone at any age, but it usually strikes older adults. Usually, it starts out as tiny cell clusters inside the colon called polyps. Although most polyps are benign, some may eventually develop into colon cancer. Polyps frequently show no symptoms. Doctors advise routine screening tests to check for colon polyps because of this. Polyp detection and removal aids in the prevention of colon cancer. Should colon cancer arise, numerous therapies can aid in its management. Among the treatments are radiation therapy, surgery, and medications like immunotherapy, chemotherapy, and targeted therapy. Symptoms. Many patients with colon cancer initially show no symptoms. Symptoms will probably vary depending on the location and size of the cancer in the large intestine. Changes in bowel habits, such as increased frequency of diarrhea or constipation, are among the symptoms that may indicate colon cancer. Bleeding in the rectum or blood in the stool. Prolonged abdominal pain or discomfort, including cramps or gas. The impression that a bowel movement doesn't completely empty the colon. Exhaustion or weakness. Dropping weight effortlessly. Causes. When DNA alterations occur in colon cells, colon cancer results. The instructions that tell a cell what to do are encoded in its DNA. The alterations instruct the cells to proliferate rapidly. When healthy cells naturally die as part of their life cycle, the modifications allow the cells to live on. There are too many cells as a result. The cells may aggregate into a mass known as a tumor. Healthy bodily tissue can be invaded by the cells and destroyed. The cells may eventually separate and disperse to different areas of the body. Metastatic cancer is the term for cancer that spreads. Risk factors. Advanced age is one factor that may raise the risk of colon cancer. Any age can develop colon cancer. However, the majority of colon cancer patients are over 50. The proportion of colon cancer cases in individuals under 50 has been rising. Physicians do not know why. A personal history of polyps or colorectal cancer. The risk of colon cancer is increased by prior colon cancer or colon polyps. Diseases of the inflammatory bowel. Inflammatory bowel diseases, which are conditions that cause swelling and pain in the intestines, can raise the risk of colon cancer. Crohn's disease and ulcerative colitis are two of these ailments. Hereditary syndromes that raise the risk of colon cancer. Colon cancer risk is increased by certain genetic variations that run in families. The two most prevalent hereditary syndromes that raise the risk of colon cancer are Lynch syndrome and familial adenomatous polyposis. History of colon cancer in the family. The risk of colon cancer is increased if one's blood relative has the disease. The risk is higher if there are multiple family members with colon or rectal cancer. A high-fat, low-fiber diet, a typical Western diet, may be associated with rectal and colon cancer. This kind of diet is usually heavy in calories and fat and low in fiber. The results of this research have been inconsistent. Consuming large amounts of red and processed meat has been linked in some studies to an increased risk of colon cancer. Not engaging in regular exercise. Colon cancer is more common in those who do not exercise. Engaging in regular exercise may help reduce the risk. Diabetes. Colon cancer risk is higher in those with diabetes or insulin resistance. A weight problem. Obesity raises the risk of colon cancer in people. Additionally, colon cancer death risk is elevated by obesity. Cigarette smoking. Smokers may be at a higher risk of developing colon cancer. Consuming alcoholic beverages. Overindulgence in alcohol consumption may raise the risk of colon cancer. Chemotherapy using radiation. Colon cancer risk is increased by radiation therapy used to treat prior abdominal cancers. Prevention. Screening for colon cancer. Physicians advise those with a typical risk of colon cancer to start screening for the disease about 45 years of age. However, those who are at a higher risk ought to consider beginning screening earlier. Individuals who have a family history of colon cancer are at a higher risk. A variety of tests are employed in the screening process for colon cancer. Discuss your options with your medical team. Modifications in lifestyle to lower the risk of colon cancer. Modest lifestyle adjustments can lower the risk of colon cancer. Consume whole grains, fruits, and vegetables in a variety to reduce your risk of colon cancer. Vitamins, minerals, fiber, and antioxidants found in fruits, vegetables, and whole grains may help prevent cancer. To ensure you receive a range of vitamins and nutrients, choose a variety of fruits and vegetables. If you consume alcohol, do so in moderation. If you decide to consume alcohol, try to keep your intake to no more than 1 drink for women and 2 for men per day. Give up smoking. Consult your medical team about quitting strategies. Work out on the majority of your days. Make an effort to exercise for at least half an hour most days. If you haven't exercised, begin slowly and increase to 30 minutes over time. Additionally, consult a medical professional prior to beginning an exercise regimen. Retain a balanced weight. If your weight is within a healthy range, try to keep it there by eating well and exercising every day. Ask your medical team about healthy ways to reach your weight loss goals if you need to lose weight. Reduce your calorie intake and increase your physical activity to gradually lose weight. Colon cancer prevention for people with a high risk. Certain medications may lower the chance of colon cancer or polyps. For example, there is evidence that regular use of aspirin or aspirin-like medications reduces the risk of polyps and colon cancer. However, it's unclear how much and for how long would be required to lower the risk of colon cancer. Daily aspirin use carries certain risks, such as bleeding in the digestive tract and ulcers. These choices are typically limited to those who have a high risk of developing colon cancer. Insufficient evidence supports the recommendation of these medications for individuals with an average risk of colon cancer.